Sunburn occurs when the skin gets too much sunshine, generally by being out in the sun too long, by ultraviolet radiation, resulting in damage to skin cells. It is common with more than 30% of adults and 70% of children and adolescents reporting at least one sunburn during the course of a year. Although most sunburns are not severe, a lifetime of sun exposure and/or frequent sunburns significantly increase your risk of developing skin cancer, wrinkles, and other cosmetic concerns.
It's Doctora Victoria and George.
Sunburn may not be immediately apparent because redness starts to develop between 3 and 5 hours after being out in the sun. Common symptoms of sunburn include reddened skin that is hot to touch, pain, and increased sensitivity to skin pressure and heat, like hot water. More severe sunburns cause skin swelling and blistering. The sunburn damage in the skin also triggers skin tanning. Tanning is the body's response to damage to skin cells. Redness peaks approximately 12 to 24 hours after sun exposure and typically fades over 72 hours. I recommend that you take precautions when you are out in the sun for extended periods of time. Wear protective clothing such as hats and long sleeve shirts, use sunscreen with a high SPF rating, and avoid being outside during peak hours when the sun's rays are strongest. For most regions, this is between noon and 3 p.m. By taking these steps, you can help protect your skin from damage caused by UV radiation and reduce your risk of developing skin cancer and other skin-related issues. Normally, the skin is protected from the sun by a substance in the skin called melanin. Melanin is a pigment or coloring that causes your skin to appear light or dark colored. If your skin is exposed to excessive ultraviolet radiation from the sun or a tanning bed, it becomes burned. The amount of UVR, ultraviolet radiation, required to burn your skin depends upon a few things, such as the amount of melanin in your skin. In general, people with fair skin and light-colored skin have less melanin and are at a higher risk of sunburn compared with people with darker-colored skin. Some people can develop sunburn after less than 15 minutes of sun exposure. But that does not mean if you have darker skin with more melanin, you can get away with skipping that sunscreen. Your location matters. People in regions that are closest to the equator and high altitudes, like mountainous areas, are at a higher risk for developing sunburn. Take extra precautions when you are exposed to a breeze, like sailing, because this masks the heat of the sun, which is a good guide to the intensity of ultraviolet radiation. Also, remember that snow reflects this light, so you should still wear sunscreen on your winter excursions. Certain medications make the skin more sensitive to sunburn as well. This includes some common medications that people use regularly, like non-steroidal anti-inflammatory drugs. This is something like ibuprofen, Advil, naproxen, diclofenac, quinolones, and tetracycline antibiotics such as ciprofloxacin, tetracycline, diuretics such as furosemide or Lasix, and hydrochlorothiazide. Other drugs include amiodarone and antifungals, including voriconazole, itraconazole, and fluconazole. If you take one or more of these medications, you should avoid the sun and use protective measures like sunscreen to avoid sunburn. Sunburn can lead to premature aging, like wrinkling of the skin, as well as skin cancer, including malignant melanoma, a very serious form of skin cancer. Sun exposure and ultraviolet radiation damage can also increase the risk of developing cataracts. This is when the lens of the eye becomes cloudy. Treatments for sunburn can help to relieve some of the discomfort. You should stay out of the sun until your skin redness and pain resolve. You can take non-steroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, or naproxen, to relieve pain. These medications are especially helpful if you take them as soon as you notice pain. The benefit of NSAIDs decreases after 24 hours. However, remember, it's important to bear in mind that you need to be careful about going in the sun afterwards, since this is one of those medications that can make you more prone to getting sunburns to begin with. For mild sunburns, there are several products advertised to relieve pain, such as cool compresses, aloe-based lotions, and lotions or sprays with a local anesthetic, a numbing medicine like Solarcaine or Dermoplast. Although studies have not proven that these products are helpful, they are not likely to be harmful. However, these products do not reduce the long-term risks of sunburn, like skin cancer. If you get a really bad sunburn, you should call your doctor to see if you can treat it at home or if you need to go to the doctor's office or hospital. This is especially important if there's blistering of the skin. If you have a really bad sunburn, your skin will hurt a lot and may have blisters on it. You also may feel very hot and sick to your stomach. If you feel this way, you should go to the hospital right away. I know George is excited to enjoy some sunshine. I hope you do too, my healthcare team. Get some vitamin D with that nice sunshine and still keep your largest organ happy, your skin, with some protective habits. Bye-bye.